Anne-Marie Carmody has brain cancer. She acquired a brain injury from surgery and chemotherapy.
Sometimes I think what's the point of me being here anyway? So I'm just a burden.
Son Sam Carmody has put his life on hold to care for her.
Constant fatigue. I've been doing it since November last year.
Anne-Marie's application to the NDIS for things like a support worker, a physio and adjustable bed was rejected. The nurse of 40 years was told her needs were best met by the palliative care system, which is funded by the states.
I just have to continue to rely on my family and friends.
On the other side of the country, Rebecca Harvey spent months trying to access the NDIS to bring her husband Glenn Downs home. The father and oncology nurse needs a carer and equipment to be discharged. His application for support was rejected because he was deemed palliative.
It's really hard on our son. I want Glenn to come home so that he can spend time in a home environment with our child.
5 months later, the NDIS agrees it got it wrong and has apologised. Rebecca will get funding to bring Glenn home, but she's angry about the time he's lost.
The long and the short of it is he needs support, and we shouldn't have to run around trying to find where to get that support.
We're hearing that there's a wave of people coming forward in the last few months who are experiencing increased barriers to getting into the NDIS.
But disability support services aren't readily available outside the NDIS.
Before the NDIS existed, there was a range of programs that were funded by state governments and the federal government to provide this kind of support. But the money for all those programs was swallowed up by the NDIS.
The Queensland Health Minister says that state has seen a change in NDIS decision-making, which has left many people, their families and carers without the necessary support. The Tasmanian Health Department says it's aware of instances where terminally ill patients are being advised by the NDIA they should seek palliative care.
The NDIS Act itself actually states that people will be supported for their lifetime. Their own organisational guidelines state that it doesn't matter how you come to your disability, whether you're born with it, whether you acquire it, or whether it's from a health condition.
We'll make sure they put the application in again.
Academic Kathy Boshin says the rules around how the state systems and NDIS services intersect are unclear.
Very much open to interpretation, unfortunately. It would be really great if we could have some sort of framework and clarity.
The NDIA insists there has been no change to decision-making for people dealing with life-limiting illnesses. It says the NDIS was designed to complement, not replace, mainstream services, and that palliative care is the responsibility of state and territory health systems. The NDIA also told the ABC it is concerned by distressing gaps emerging in support for those deemed palliative. It's also seeing an increase in numbers of people applying to the NDIS whose primary need is palliative support, and the number of people accessing the scheme with terminal illness as their primary disability has doubled in recent months.
We don't have time on our side when people have life-limiting conditions, so we really need to be able to support people functionally in their home, and if it's not the NDIS, then we need to find something that sits in that gap.